APOSI peeps! Welcome back to our Wednesday wellness webinar. Our topic for today is about dementia. So what are the key topics or the discussion that we're going to do? So the definition, signs and symptoms, types of dementia, stages of dementia, risk factors, diagnosis, treatment, and prevention. So what is dementia? So dementia is a group of symptoms caused by other conditions or symptoms related to memory, language, and decision making. So it is a major neurocognitive disorder and it's not part of normal aging. It's because kapag makakalimutin ka or you tend to forget something, it doesn't mean you already have dementia. So it's a broad term that describes a loss of thinking ability, memory, and then attention, logical reasoning, and other mental abilities. So these changes are severe enough to interfere with social or occupational functioning. So on your right side, nakikita niyo yung picture. So those are the things that may affect if we will encounter or we will have dementia. So what are the causes? So for degenerative neurological diseases, or that is something to do with the parts of our brain. So we have Alzheimer's disease, Parkinson's disease, and Huntington's disease. If you can still remember, these topics were discussed on the previous weeks. And then for the vascular disorders, we have traumatic brain injuries, infection on the central nervous system or on our brain, and punta sa spinal cords natin, and then long-term alcohol or drug use, and then certain types of hydrocephalus, buildup of fluids in the brain. And then there are some reversible causes of dementia, which includes alcohol or substance use disorder, tumors, subdural hematomas or bleeding, and then normal pressure hydrocephalus, metabolic disorders such as vitamin B12 deficiency, low levels of thyroid hormones called hypothyroidism, and low blood pressure and HIV-associated neurocognitive disorders. So it doesn't mean if you have HIV, meron ka ng ganyan. But there are some conditions also that may be related to HIV that may cause also dementia. What are the signs and symptoms? So, difficulty to complete everyday tasks independently. So, like fixing a meal or paying bills or yung mga basic activities natin, even doing the household chores, if we will not be able to do it. So, medyo obserbahan natin yon. And then communication problems like not being able to come up with the words or to refer or familiar objects. Kahit yung simpleng susi mo, hindi mo na siya maalala kung saan mo siya nilagay. Kahit lagi mo siyang nilalagay doon. And then getting lost in familiar neighborhood or places. So if you're going home from work to bahay, hindi mo na maalala kung saan yung daan punta sa bahay. And then forgetting old memories, names of people, family members. So even the persons na nakasama mo, even your spouse, you tend to forget their names. And then sometimes becoming lost in familiar places like churches, supermarket, hindi mo na matandaan kung paano mag-drive doon. So that's one of the signs and symptoms. And then unaware ka din with the time and place. However, before you diagnose yourself with that, kailangan mo pa rin ng series of diagnosis. Types of dementia. So we have two, irreversible or progressive, and the reversible. For irreversible, of course, Alzheimer's disease, it is the most common cause of dementia. It's because dementia and Alzheimer's medyo magkalapit lang yung signs and symptoms nila, or should I say, most of the signs and symptoms nararanasan ni Alzheimer's, but that's one of the types. And then the vascular dementia, so this type is caused by the damage of the vessel that supplies to the brain. So kapag hindi maganda yung mga blood vessels natin to the brain, then the brain functions that I have mentioned, so it will be diagnosed as vascular dementia. And then the other one is dementia from Parkinson's disease and similar disorders. So including Huntington's disease. So magkakaano yun sila minsan, magkakasabay-sabay. And then dementia with Lewy bodies. So that bodies, ano siya, abnormal balloon-like clump of protein na meron sa katawan natin. So hindi lang si Lewy body dementia ang meron. Nakikita din siya with Alzheimer's and Parkinson's. frontotemporal dementia or PICS disease. So this one, ang affected is breakdown of nerve cells sa brain natin. So, ang connection niya is sa frontal and temporal lobes of the brain. So that's why tinawag siyang frontotemporal. And then yung areas doon na affected is yung mga personality, behavior, yung language. So common symptoms for that is maapektuhan yung behavior natin, the way we think, the way we judge, when it comes to problem solving, and then judgment, language, and movement din natin sa katawan. So ano siya, halo-halo na siya when it comes to with body's dementia. And then the Creutzfeldt-Jakob disease. So this condition is very rare, pero it occurs siya without known cause. Wala siyang specific reason kung bakit siya nagkaroon ng ganyan na disease. However, yung definition for that, it's because of the infectious proteins called prions. So, ang prions is a type of protein that can trigger normal proteins into the brain that will create abnormal proteins din. So, parang autoimmune disease siya, kumbaga. Ay inaatake niya yung sariling protein niya. And then wala siyang known cause. Bakit ganon? And then yung Huntington's disease, so that's the one that I have discussed last week. And then for reversible, ibig sabihin, pwede siyang mabalik or hindi mag-progress yung dementia niya once we have encountered this. So infectious and immune disease. So it doesn't mean na kapag meron kang mga autoimmune diseases, magkaroon ka kaagad ng dementia. No, it's not. Basta with proper medication, proper medical management, it will not be progress to dementia. And then metabolic problems and endocrine abnormalities. So yung mga parts ng brain natin o yung mga hormones na kapag nakokontrol naman siya ng maayos, hindi siya magpa-progress to that. And then nutritional deficiencies. So meron namang mga dietitian, including nutritionists that will help us out to address the deficiencies for nutrition. And then medication side effects. So maraming side effect yung medication. As long as it will be managed properly, then that's okay yung patient. And then brain tumors, that's a rare cause. And then subdural hematoma, so active bleeding. So there's a part of our brain na magbi-bleed siya, of course, pag hindi naman affected yung brain, that will cause dementia, and nakukuha naman siya sa gamot as what I've mentioned, then it will not progress. And the normal pressure hydrocephalus. So hydrocephalus, ito yung accumulation of fluid sa brain. So kapag na-control naman yon, or there's another way of treating hydrocephalus, then you will not encounter dementia, or you will not experience this type of condition. What are the stages of dementia? So we have 7 stages. So first is no cognitive decline. So walang impairment. However, someone at this stage will show no symptoms, but kapag nagpa-test naman sila, there are possibility na magkakaroon sila ng dementia. So number 2, very mild cognitive decline. So you may notice slight changes sa behavior, but your loved one will still be independent. So ang itong person na to, hindi naman gaano ka-affected yung the way makitungo yung patient, or even the way he or she thinks, hindi siya ganun pa ka-affected. And then third stage, that's mild cognitive decline. So this one, ang changes na mapapansin is the way they think, and yung reasoning niya um, hindi na masyadong parang hindi niya pinag-iisipan, or gusto niya namang sabihin pero he cannot express it kasi nga nagkakaroon na ng changes the way siya mag-isip, or the way he respond or think to a specific situation. Ang stage 4, that's cognitive, moderate cognitive decline. So medyo maraming problem na sa mga plans, may mga recent events, they tend to forget it. Sometimes gusto niyang kunin yung cellphone, remote control yung nakukuha. So medyo nalo-lost na yung identification niya of the things that they see when it comes to this stage. So stage 5, moderately severe cognitive decline. So at this point, they'll need assistance na. It's because some basic day-to-day functions such as picking out clothes to wear, so medyo nahihirapan na sila on this part. And then even fixing yung meal, as what I've mentioned, medyo nahihirapan na siya kahit nung paglagay lang ng tinidor or kutsara, hindi niya nalalaman kung either sa left ba or sa right niya ilalagay, ganon. Yung mga simple things na ginagawa niya everyday, affected na siya. And then on the sixth stage, which is the severe cognitive decline, so they tend to forget the names of their spouse na siya. Ng time na yan, ano na, hindi niya na maalala kung sino, not just the spouse, but also the person that they're close to them. So, mga anak niya, mga pinsan relative, even the parents, or yung mga taong nakikita niya everyday, parang magtatanong siya, sino kaya siya? Saan ko ba siya na-meet? Yung mga gano'n. So, hindi niya na maalala even the dates kasi nga nag-progress na yung stage ng dementia. And then the last stage, that is very severe cognitive decline. So that's the end stage of dementia. So they can no longer speak, they can no longer walk, and then they spend more time sa bed kasi nga yung katawan nila, aside from their cognitive function, their body tend to slow down na and hindi na sila makakagalaw. So if you can remember the Parkinson's disease, the Alzheimer's, and the Huntington's disease, kapag nag-show yung symptoms ng tatlong yan, so medyo na mahihirapan ka talaga. It's because you are risk na sa fall. So if you want to go to the bathroom or kahit magbangon lang sa bed, there should be someone else to assist you. Kasi nga, malulos na yung balance mo and yung katawan mo is mahina na. So that's the end stage of dementia. So risk factors. So number one, hindi talaga natin may kakaila age. So as we grow old or if may history din tayo ng dementia or hindi lang dementia, kundi yung mga diseases that could lead to dementia, then high risk po tayo doon. And then the Down syndrome, it's because yung DNA nila magkaiba yung mutation o magkaiba yung DNA nila. So there's a tendency na magkakaroon but not all magkakaroon ng dementia if you have Down syndrome. So can be changed or we can at least ma-adjust natin. So diet and exercise, excessive alcohol use. Kasi mga kapag ang alcohol is ano yan siya, the main organ that will be affected is yung brain. So if excessive alcoholic beverages, then it will be affected talaga. And then cardiovascular risk factors, kasi nga subdural hematoma or yung mga bleeding sa brain natin. And then depression, and then diabetes, poorly controlled. So kapag napabayaan, pwede siyang mag-lead or mag-complicate. And then smoking, air pollution, head trauma, sleep disturbances, vitamin and nutritional deficiencies, medications that can worsen your memory. So what are the diagnoses na ginagawa in order for the doctors to rule out dementia? So there are series of testings like blood and urine test, and then chest x-ray, so brain scanning, MRI or CT scan. So lagi natin yang nai-encounter when it comes to checking ng size ng brain, even mga internal bleedings, na-check nila yan. And then electroencephalogram, so EEG, and then spinal fluid analysis. One of the causes earlier is the hydrocephalus, and then they use certain criteria to diagnose also the dementia. So they have impairment of attention, orientation, memory, judgment, language, motor, and spatial skills, and function. By definition, dementia is not due to major depression or schizophrenia. It's because maraming ang nire-rule out or chine-check si doctor. So of all the diseases, ano siya, as what I mentioned, group siya. So it doesn't mean isa lang yung magiging cause niya, magli-lead na siya sa dementia. So of course, marami talagang mga series of tests that you need to undergo to confirm that this person is having dementia or simpleng Alzheimer's lang pala yung na-encounter niya, or Parkinson's or Huntington's disease. Treatment will depend on underlying cause. So, Aduhelm is the first drug approved by the FDA to treat Alzheimer's disease in decades kasi nga Alzheimer's and dementia is closely related lang sila. And then medicines such as acetylcholinesterase inhibitors can sometimes help to slow the progression of cognitive changes. So, mayroong specific medications for that in order for a patient na hindi mag-progress yung disease niya into dementia, or at least hindi naman mag-progress ng sobrang severe na umabot na sila sa point na sa stage 7 na yung patient. What are the preventions? So we have to be physically and socially mentally active. So kung ang dementia is affected yung brain, so we have to do some cognitive exercises. So sa na-research ko, we can at least read books kasi yung brain kasi natin, if we tend to exercise our brain by reading, problem solving, pwedeng mag-exercise ng brain natin. And then manage cardiovascular risk factors, of course, yung mga hypertension, yung nagkakos ng mga internal bleeding, so we have to at least consult your doctor if we have that. And then maintain healthy lifestyle, so quit smoking, it's highly recommended. Get good enough quality sleep and enough vitamins, and then treat health condition like depression, anxiety, or hearing problem. Though there's no sure way to prevent dementia, but there are steps that you can take that might help. So more research is needed, but it might be beneficial to do the prevention or tips that I have mentioned, at least hindi tayo magkaroon ng mga diseases that will affect our cognitive or our brain functions. Thank you for attending, guys. Before we end this wellness webinar, so if you have any concerns or topics that you would like us to discuss, you can simply message us, a APOSI Clinic team, or you can contact me directly. So thank you, guys, and have a great day. Bye.